Hello, everyone. Thank you so much for inviting me to Akha Khan University. I'm really happy today to introduce myself and our project. My name is Dr. Gulnaz Anjum. I'm an associate professor of psychology at University of Oslo in the Department of Psychology. So I'll be presenting the role of AI in mental health. What are the impacts and what are some of the opportunities? Before I go further into my presentation, I would like to say a very special thank you to Dr. Nida Khan. She has been an amazing collaborator, and I'm very happy to participate in this workshop through her. So let's first start with what is the agenda for today. So I'll introduce you to psychological needs. What are various psychological needs that are hampered that people have to go through mental health related issues? We'll talk about why mental health matters, why it is such a huge area, and why the impact is so big. We'll also talk about different technologies and why those technologies matter. What are applications of this technology in mental health? And lastly, we'll talk about mental health cases for measurement, how we have developed some sample cases and how that can help other people develop their own cases. And lastly, I'll conclude with some remarks. So, when we think about mental health or mental health related issues, it's really important to know what is it that got hampered and why people go through these difficulties. So there are multiple models in psychology, and many times some of them they are deterministic. So we tend to use models that are less deterministic. And the essential idea is that if we can measure behavior and if we can make recommendations based on that, then how can actually we lead to a soft spot where we can actually intervene and provide some feedback. The first theory is self-determination theory, which talks about three basic needs. One is relatedness, other is autonomy, and the third one is competence. So if any of these needs are hampered because of any reason, that leads to some complications and it could lead to mental health related impacts on people. The second theory is about precarity and life in a limbo. So if people are struck with kind of a shock, which could be climate related, a war, or any major incident that has an impact on their life can become some sort of a limbo where they are not able to manage their psychological needs because of these external, very difficult events that are unfolding around them. And the third idea or the framework to think about is multi-level vulnerabilities, where it's not just what usual or everyday life has an impact on people, and the difficulties are not meeting those needs, but also some other vulnerabilities like being in a war or any other climate shock, and then combination of different factors where people are not able to prioritize the psychological needs that they need to fulfill in order to stay healthier or not have any challenges for their mental health. So the impact of these, any of these models, it can be huge. For example, if we look at some of the data that comes from World Economic Forum, in 2016, roughly 11% of our population on any given day might be struggling with some of the disorders, on top of which we have anxiety disorders, we have depression, alcohol use disorders, drug disorders, and many others. So you can see the major impacts they lie in anxiety disorders and depression. And when we think about anxiety disorders, there are many other comorbidities that exist within that. For example, obsessive compulsive disorders, which are a huge overlap with some of these disorders. So, what are some of the anxiety and obsessive compulsive disorders related global and local impacts that we see in different contexts? So, there are millions and millions of people that are impacted, roughly 4% of our global population, which is huge when it comes to anxiety. So, it is a disorder which is very prominent almost in every conversation, from students to any high impact population who have been struck with different kind of shocks or difficulties. Then according to World Health Organization, OCD is the 10th highest prevalent mental health disorder where it causes daily based disabilities among people. The numbers are really huge, and which is also kind of 10% of these people who go to treatments, which is quite a bit of representation compared to many other psychological disorders. Then also, there are very non-linear representations of different populations. For example, in many Asians or any other non-European, non-American populations, people are really not coming forward with the representation of this disorder, especially when they have to self-report. So I think in that sense, use of sensor data AI would be really an amazing opportunity for such populations. And we know that, especially in the case of Punjab, some of the studies that we already know of, there is roughly 4% of the psychiatric clinic representation by people who suffer from OCD. And most of the time, we know that it's related to the contamination related symptoms. So, for example, in places where germs or like anything related to contamination is higher, populations may have higher concerns for OCD as well. So, what is the role of AI in mental health? As I said, if there is a huge area where there is a big presentation of human mental health related impacts, and we are talking about millions of people. Of course, artificial intelligence can be very beneficial in the field of psychology. Anyone who is helping in terms of providing support for mental health issues, for example, counseling, psychiatry, where individuals who are suffering from many or like singular or multitude of emotional and behavioral disorders, they're assessed and treated. So AI technology has a potential to open new possibilities for addressing mental health challenges more effectively, especially because we are not spending a lot of time in self-reporting, and many times people might not report those disorders correctly. Various applications that have already been a hallmark in presentation of what already exists, especially when we were looking for our project and some of the studies and the apps that have already existed. One of them is late life depression monitoring, which is really focused on the behavioral symptoms that can be assessed using these wearable sensors. And that was also kind of a good ground work for us understanding what kind of behaviors are being noted or denoted when it comes to measurement of mental health issues. Another one is student life, which is about detection of students' depression. And we know that, especially when people are going through difficult times, difficult episodes, for example, going through exams and all of that, what kind of behavioral measurements could help us in understanding. So these kinds of apps, they have a huge help in assessment of those. Then cross-check, which is a system to assess the symptoms of schizophrenia. And as you can imagine, it is one of the toughmost psychological disorders in psychiatric or psychological terms. So I think it was a really powerful app where they could look at the behavioral assessments and report back and see if the person has those symptoms of schizophrenia that needs to be diagnosed early on or as soon as possible. And then lastly, the app, which is application Boost Me app, which is an emotion regulation solution to enhance cognitive performance. And in many populations, for example, students, when they are really down or when they're perceiving that they're not feeling well, so in those apps, you could actually send them messages to regulate their emotions, which would again be based on very behavioral measurement of what they are doing at any given time, and that real-time reporting of data could feed back into how to regulate their emotions. So these are some of the applications that have already inspired our work, many other works in mental health related domain. Anxiety, as I said earlier, is one of the biggest challenges in population that is like, doing day-to-day tasks or people who are actually diagnosed with the disorders. So anxiety is really a very intense feeling of worry. Sometimes it can be mild, sometimes it can be severe. And everyone has those feelings of anxiety at some point in life. And that's why we know that roughly 30% of population, they go through this and they experience it at least once in a lifetime. And one may feel worried and anxious about any smallest thing or the largest thing if you're sitting in an interview or going for an exam, or if you're organizing like a major event. All of that could lead to anxiety. But it's not that anxiety is not good for us, it's also something that prepares us for difficult events. So it has its own potential positive role, but then we know that sometimes when it goes out of hand, when it becomes more difficult to manage, that's the time when we think about anxiety disorder. This involves persistent and excessive worry, and it could be triggered by a very small event. For example, just looking at a spider or seeing someone walking their dog, or any minor event that wouldn't be that stressful in other circumstances. This is a persistent feeling of being in a danger, which interferes with daily function of people, and it causes multiple problems for them to live their everyday life normally. And we know that according to APA, which is American Psychiatric Association, the most common form of mental disorder is anxiety, which is roughly 30% of population that goes through this disorder. For us, in order to measure behavioral markers of anxiety, that was the first step to develop a model where we could bring in certain behaviors based on a lot of literature that we had reviewed over the last 2 years. And then we also needed to be discrete. What are the behaviors that we would be able to actually pick through our sensors when we were working with our models? So, behaviors like nail biting, hair pulling, increase in heart rate or rising blood pressure or increased sweating. And For example, like, people not, um, um, uh, for example, people not like, monitoring or not thinking too much about the fact that they're rubbing their hands quite a lot. So that is a behavior, or all of these set of behaviors, these are the ones that could be easily picked by the sensors. So this is the model that we use for measuring anxiety in our participants. The second model that we developed was for obsessive compulsive disorder, which is OCD. As we know that this is a mental illness which is characterized by fixation and self coercions, which are cognitive and behavioral. So, of course, it's harder to measure the obsessions, which is the cognitive or the mental part of this disorder. But what we really focused on was the compulsions, which are the ritualistic habits or the behaviors or the overt acts when someone feels that, like, these obsessive thoughts are there, to play out that behavior. What kind of model could be developed and used? So this is what we have developed. For example, excessive hand washing on repeat, showering, bathing, or mopping, cleaning, all those behaviors that can show us persistent movement, and that are beyond the normal or the baseline behavior. So we use this model for assessment of OCD among our participants. So, what are the potential research samples? Nida is going to later on also talk about relevant research areas where these applications and these models, they could be more relevant. But I also briefly want to talk about potential research samples. For example, we could use the AI technologies to measure in, let's say, relatively healthy populations where we could support students, where we could support young adults and others. But there are also samples that could be more crucial for our assessments. For example, pregnant women and how they're stressed out or anxious about child rearing and childcare practices. We could also think about implementing hard technologies or any other sensor based AI in elderly care homes where people are not particularly sort of like, okay with reporting what they are feeling or their emotions, or sometimes even simple reporting can be a very difficult task for them. Then, in addition to that, in migration and acculturation, when people move from one place to another around the world, those are also very high intensity and psychological anxiety provoking episodes in their lives. So it could be used there. In addition to that, now we know that climate anxiety is becoming one of the biggest things around the globe. So, implementing some of these models there would also be a wonderful application of this work. Last but not the least, when it comes to disasters and a war context, for example, after earthquakes, or contexts like a war in Ukraine, or a recent disaster in Syria or in Turkey because of the earthquakes, these are also some potential samples where you could actually do basic need assessment, do the baseline, and then implement some of these studies there. Another element that I wanted to bring up for today is related to the media appeal and how to reach the masses. So, as researchers, we do fantastic work, but sometimes what we do, we tend to forget that there is a lot of audience out there that might be scared of, let's say, breach of their health data, how to work with these studies or how to participate in these studies. So, how do we convince them? So, in our recent work, every time we publish our data or we publish our research articles, we reach out to very powerful sources. For example, LA source, which is Forum for Diversity, where we bring in and we hear multiple voices. It's a big time magazine. So, pitching your work there, I think it's also really important. Not only like, to apply the work that we do, but also to extend it to audiences that could actually lead it to the next level, where we could promote our work in a more impactful way. Similarly, when we published our study on the human activity recognition, we also made sure that this reaches out through social media and also through press media. So it's important not only to collaborate to create impact, it's also important to engage with media, social media, and different forums. So these kinds of forums, they have been really important for us for pitching our work to public, and also to bring the knowledge from multiple fields together and putting it forward through the media. Just to summarize, finally, I think it's really important to recognize that developments in mental health measurement related innovation and measurement, they are vital because not all the time we will have the opportunities to sit with people and do self-reported measurements, and there might be language and other barriers in different contexts. Secondly, it is really important that we continue our multidisciplinary collaborations. For example, as a psychologist, when I work with people who are AI experts and computer sciences experts, or people who are really well versed in health related issues beyond mental health, it begins really important points for fantastic collaborations. And lastly, I think we need to apply the findings to more mental health disorders and among populations at risk. I think we really need to extend and see what is beyond what we are already doing and how to generate more impactful work. I'll leave you with some of the references that I have quoted here so that you can go back and have a look at all of this work. In addition to that, if you would like to see some of the links or our own media and press releases, you could also look at some of the links at the end. I would also like to acknowledge the wonderful team that I've worked with, especially Dr. Nida Sadaf Khan, who has been really an inspiration and who was the one who brought us all together. Also, Dr. Saeed Ghani, who has been really an amazing collaborator to work with. And also, these two people, they have merged many boundaries and cross-disciplinary boundaries between our disciplines. Thank you so much for listening. And if you have any questions, please feel free to reach out to me at my email, which is gulnaz.anjum at psychology.uio.no. And also feel free to browse through my website. And if you have any comments or any suggestions, please feel free to reach out to us. I'm very grateful for this collaboration, and thank you so much for inviting me for presenting our work. I think Nida's work will nicely segue into what I have finished here. Thank you so much for listening, and thank you so much for giving us the platform to present our work. Thank you.